Welcome to today's panel on head and neck cancer, understanding it and early detection and better outcomes, being organized by Voice of Healthcare and powered by Local. Early detection can significantly improve outcomes, yet awareness remains low. Together, we'll explore that how signs and symptoms, risk factor, and advances in diagnosis and treatment affect head and neck cancer. Our goal is to empower patients, caregivers, and professionals with knowledge that leads to a better and life-saving outcomes. Our speakers for today's session are Dr. Chetan Deshmukh, consultant medical oncologist, Deenanath Mangeshkar Hospital and Research Center, Pune. Welcome, Dr. Chetan.
Thank you.
Dr. Nilesh Madhukar Lokeshwar, consultant medical oncologist, Zen Hospital, Chembur and Lilavati Hospital, Mumbai. Welcome, sir. Dr. Chetan Bakshi, consultant medical
Thank you.
oncologist, Jupiter Hospital, Thane, Mumbai. Dr. Chetan Bakshi, welcome.
Thank you so
Dr.
much.
Chetna Bakshi, I'm sorry.
Thank
Dr.
you.
Rakesh, Dr. Rakesh Taran, senior consultant medical oncology and hematology, Taran Onco Care, Indore. Welcome, Dr. Rakesh.
Thank you, ma'am. Hi, everyone.
Hello.
Dr. Ashish B. Agarwal, Senior Consultant, Medical Oncology and Hematology, Kiran Multi-Speciality Hospital, Surat. Welcome, Dr. Ashish.
Thank you. Thank you.
Dr. Nilesh Dhamne, Chief Medical Oncologist, Kolhapur Cancer Center, Kolhapur. Welcome, Dr. Nilesh.
Hello everyone, and thank you for the invite.
Okay, so I think we would start with understanding the disease landscape first of head and neck cancer. So my first question goes to Dr. Chetan Deshmukh. Dr. Deshmukh, based on your experience, what are some of the early signs and symptoms of head and neck cancer that tend to go unnoticed? And how can we encourage timely consultation?
In my opinion, the earliest sign of oral cancer, which often goes unnoticed, is a non-healing ulcer anywhere in the oral cavity, soreness, loosening of teeth without significant tooth decay or significant pain. In fact, painless loosening of tooth is usually associated with an alveolar malignancy, and difficulty in opening mouth or a sore or a boil in the oral cavity. These are lesions which are often overlooked by patients. They assume that it is related to their food habits or some trivial injury due to hot, spicy food. And they tend to neglect this symptom for a very long time. They keep applying all kinds of ointments and gels and lotions for the ulcer, but such ulcers often turn out to be malignant, and they can be diagnosed by a simple visual examination under adequate illumination.
Right. So a non-healing ulcer is, I think, the earliest sign of head and neck cancer, especially if it is not being healed after giving antibiotics, and that can easily be detected with the help of simple illumination, as you said. Dr. Nilesh Lokeshwar, Dr. Lokeshwar, we often speak of importance of multidisciplinary care. From your perspective, how does involving various specialists early on impact patient outcome?
So in most cancers, this is the time and era for having multidisciplinary treatment. And this is even more relevant in a disease like head and neck cancers, where more than 70% of your patients will have advanced disease. In fact, the number of patients who probably undergo only surgery in head and neck cancer is less than 20%. And treatment for most patients either involves an upfront surgery, sometimes chemotherapy before surgery, after surgery, and once you have the histopathology report, patients often undergo radiation with chemotherapy. And in some such situations, patients may get palliative chemotherapy or palliative immunotherapy. So, apart from these three specialities who do the direct treatment for cancer patients who've got head and neck cancers, I think there are a host of other specialists who are involved. So, for example, radiologists who diagnose the disease, many of these patients present to dentists, and dental surgeons are also involved in the treatment, again with ENT surgeons. And the treatment of head and neck cancer comes with considerable morbidity. So patients have mucositis, they have difficulty swallowing, speech and hearing, and therefore speech and audio therapists as well as dietitians are very important during the treatment for these patients. And this is best approached in a joint clinic setup where you have doctors from different specialties who all together evaluate the patient, chart out a plan, evaluate the patient mid treatment, and then make changes as required based on how the patient is doing. And one more area which is often neglected is pain and palliative care. While pain control has to be started right at diagnosis, some patients who have progressive disease may land up with palliative care, and integrating palliative care earlier on in the treatment paradigm is extremely important. So, this whole concept of treating head and neck cancers should be done in the fashion of a joint clinic, which is what is done in most high volume centers, and even in individual practices as much as possible. Involving all these different specialities goes a long way in improving the results in head and neck cancers.
Very well said, sir. Speech therapy is one thing which I think be involved in this because, as you said, that it is involved with mucositis and speech problems, and of course, various other morbidities as well, and pain also should be taken care of. Right. So, Dr. Chetna Bakshi, what are some practical steps we can take to increase awareness about head and neck cancer symptoms, especially among the general public and primary care providers?
Yeah, so about the awareness, the first thing, I mean, symptoms, yes, but first thing I think we should increase the awareness that the major cause of head neck cancer is tobacco in our country. Tobacco in any form, right from masheri, tobacco, gutka, cigarette, bidi, whatever. So that is the first thing which we need to do when we say increasing awareness. So no tobacco campaign is something which we should start right from the schools, colleges. And then regarding the symptoms, we should make general physicians more aware as well as the normal population that when patient will always go to a general physician with some kind of ulcer in the oral cavity, or he has difficulty in deglutition. So there has to be a high index of suspicion that if patient is not getting well within 15 days, he has to be referred to a specialist, not necessarily oncologist, but they can send to a person to a ENT person, ENT doctor, or somebody who can, look into it and do the biopsy. So that is what I think that we should take more and more CMEs and lectures. Social media will help to increase the awareness amongst the public and general physicians regarding the signs and symptoms. Social media plays very important role, and awareness lectures in schools and colleges will also help. That's what I feel personally.
Right, right, ma'am. I think integrating primary healthcare physician as well as dentist, for that matter,
Yeah.
is very important because in that way we can catch the disease early. Dr. Rakesh Taran, how do you approach patient education when it comes to understanding the link between lifestyle factor like tobacco, chewing, or oral hygiene and head and neck cancer?
As Dr. Chetna ma'am, and you had very well pointed that the major role is played by the primary physicians, maybe in the part of dentists, to make the aware, to make the general public aware about the tobacco and its ill effects. Not only tobacco, it's oral hygiene, it's regular routine oral checkup or dental checkup, which should be a must. So, because in this part of the world, head and neck cancers are quite prominent. So, ideal will be regular or thorough checkup, just like we say for a breast, you should go for a mammogram. Or it should be if you are a tobacco chewer or something like not a good oral hygiene maintaining. So, go for a regular dental checkup or oral checkup. Maybe the dental persons can help us with screening early cancer and coordinating with other staffs and making lifestyle changes appropriate to prevent or to detect in early phases of the disease. As Dr. Chetan Deshmukh sir has rightly pointed out, the sole or a small ulcer or a painless tooth extraction, it should be taken care of because Most of the time, the even the dental person, they neglect it कि नहीं ये थोड़े दिन देख लेते हैं. That should be a limit कि ये
There's some network issue, I think. Okay. Dr. Ashish, I think I'll ask you the next question. Um,
Yes.
in your clinical in your clinical experience, what are some of the most common delays in the patient journey from symptoms onset to diagnosis? Now, how can we bridge this gap?
The most common delay is that they ignore the symptoms. They thought this no, it's a ulcers. It's maybe because of vitamin D deficiency or maybe some other cause. So they just ignore the symptoms and not go to any specialist for the checkup. Another is the taboo that and the fear that if I got something like cancer or maybe got some other major issue, then might be there's some problem. And the third is in our country also some monetary issue, like sometimes patient, the poor patient, they don't have access to physicians or oncologists in the small center. And at the small center, the specialists, they are not very well versed with the oncological symptoms like eating ulcers or any swelling. So they treat like give only symptom treatment, and then when they reach up to stage 3, they come to oncologist. So the main I think we can bridge by the education and awareness. We can reach to the small center like in the tertiary in the small center, primary center, and take education of the physicians or a dentist or the the local physicians like BMS, BHMS, and explain them to what is the symptom signs of head and neck cancers, and when can we can refer to the tertiary care center. And the continuous medical education like CME, we can take the CME workshop, and also use the social media and technology like WhatsApp group, WhatsApp educations, or sometimes YouTube. We can give education to YouTube. So there are so many way, because now we are so many technology by which we can reach to the populations and to the physicians.
Right. I think awareness is the key, and since awareness remains low, so digital tools can definitely help us create awareness. So, Dr. Nilesh Namne, are there any region specific challenges or barriers you have encountered in raising awareness or ensuring early detection of head and neck cancer?
Yes, absolutely. Now, region specific, there are variation of tobacco consumption. So, compared to Western India, or especially in Tier 2, Tier 3 city, the consumption of tobacco may be the direct use, oral use, chewing tobacco may not be inhalation of cigarette. So, the patterns of the cancer may be different. The lack of awareness, the simple symptoms like what we are discussing, painless ulcer, non-healing ulcer, loosening of teeth, throat swelling, neck swelling, changes voice, they may taken as a normal and they not considered as a cancerous symptom or any precancerous lesion like white or red patches. They may not consider as a precancer due to lack of awareness. Stigma, as a previous panel saying, having a cancer can be a social stigma. Going to a doctor, they don't feel like accessing, and when they present to a doctor in tier 2 or tier 3 city, maybe stage 3 or stage 4 by the time it's been diagnosed. Another is a lack of access to healthcare, as Dr. Rakesh was saying. So a lack of onco specialist, maybe even lack of ENT specialist. If they consider, they should show to ENT doctor for early diagnosis. So in a different setting, there may be lack of access to this particular setting. Fifth is economic. A daily wages worker, so not going to work and presenting to a doctor for this, any of these symptoms may cause a loss of wages, and that may prevent them to access healthcare and diagnose at an earlier stage, and that may cause a significant problem that not getting diagnosed and treated at earlier stage, and unfortunately they diagnose at a stage 3 or stage 4. That is the real story.
Right. So to detect this early, we have different diagnostic tools, and I think it should not go to stage 3 or stage 4 where the treatment becomes more complex. So, how can Dr. Chetan we use these evolving diagnostic tools? And what do you feel are the most practical and effective methods currently available for early detection in everyday oncology settings? Dr. Chetan Deshmukh.
Yeah, yeah, I can hear you. So, early
Yes.
detection for oral cancer, there is no formal screening method. There was some paper from Kerala where they had tried a simple test called mouth self examination, which was examining one's own oral cavity under adequate illumination. Unfortunately, that study did show that they detected some cancers early, but I don't think they had really reduced the incidence of advanced cancers. So they have also come up with an instrument called Veloscope, which supposedly detects oral cancer early, but I have not used it. Unfortunately, most of the cancer screening in our country happens in an opportunistic fashion. There is no protocolized cancer screening as such. And screening, any screening activity, if it is not done periodically, then it becomes nothing but a futile exercise, because screening has to be done at regular intervals to detect changes. So, if not for the entire population, at least for those patients who have a high risk situation, like for lung cancer, we have select criteria for whom we are promoting lung cancer screening. Similarly, for people who have consumed tobacco for a certain amount of time, or other people who have other risk factors like ill-fitting dentures or poorly maintained teeth, these people should be subjected to some kind of screening, or at least some kind of visit to their dental surgeon, oral surgeon, or an ENT specialist. But by and large, data for oral screening is very, very poor and not very promising. The best way to prevent oral cancer today remains tobacco, preventing tobacco habit.
Right. And sir, what are the few diagnostic modalities available where it can be picked up early? Illumination, of course, you have told, and you have told us also about some veloscope. Uh, are there any other tools which can be used?
None of them which are practical in a public setting or on a mass scale. It is usually symptom directed. If a patient walks in with a lesion in the mouth, is there, if he has an ulcer or an area which is suspicious looking, or if there is a swelling, then a biopsy or even a needle aspiration cytology can give you a clue about what the lesion is. But these are again purely symptom based evaluations. They are not screening tools.
Right. Right, sir. Definitely cytology and biopsy that can be taken if there is a suspicious ulcer. And we should, I think, screen more often. That is, again, a very good tool or a way of catching the disease early. Dr. Chetna Bakshi, in your opinion, how can we better integrate awareness campaigns into routine community and hospital-based, health education programs?
So I think the easiest way to do it, we should involve the residents and sisters because they are always there with us, who take rounds. So if we educate them, they can go back to the society and educate their own people. This is one thing. Then frequent CMEs is very important. So when one can have continuing medical examination education for the general physicians, dentist, and we can discuss more about what are the early signs and symptoms and how to suspect that this patient has got carcinoma and when to refer. So all these things we can integrate into a hospital setting where we can help to diagnose these cancers early.
Dr. Rakesh Taran, how do you approach treatment discussions with patients to ensure that they are fully informed and emotionally, supported during this difficult diagnosis and treatment?
Uh, uh, Dr. Manisha, I feel this is the most important discussion because जब patient most of the time हमारे पास आता है, they are with the report and there is a big question mark on their face कि what next. So सबसे पहले what we start is or I start is I prognosticate them first कि this is a very small lesion or this is a primary thing and you are going to get cured, that is for sure. need not worry. And then gradually you discuss about the surgical part or radiation part or the chemotherapy part. But first and foremost thing is the chances of cure, what they want to hear is. And second is the most important point is maybe we can take something like tumor board or a dentist with us to examine how are the things, what is the thing in very first look, how we are going to proceed. Because most of the time, whenever the patient comes to us, it's a relatively not that early stage which can be taken care of. It is sometimes or most of the times stage 2 or stage 3 disease. So more and more frequent biopsies and awareness about the biopsies, key biopsies or FNACs, they are not going to endanger your life, but they are going to cure your things at an early stage. Because still there is a myth once you biopsy, it's going to flourish in a very rapid way. So these all myths should be taken care of.
Right. Right. All myths, should be taken care of, and definitely patient should be explained well that what are the chances of, cure, and how can, prognosis be explained to the patient. That is also very challenging. So, Dr. Nilesh Lokeshwar, from your experience, what can be done to make follow-up care and survivorship support more accessible and structured for head and neck cancer
There are two important issues that patients have. One is the concern and the awareness that there can be a recurrence, and identifying this is important. And the second is recovering from the short term and long term side effects of the treatment. Now, with regards to recurrence, all patients who have completed treatment are generally followed up frequently in the first year or two. That generally involves 3 monthly evaluation for the first 2 years, which can later be increased to 6 monthly and then once a year. Fortunately, because head and neck is an area that can be very well examined, most of these patients do not require extensive investigations. A good clinical examination and symptom based imaging, if required, will help us identify whether or not there is any recurrence. So, generally, follow up protocols are well structured and most patients are explained about this. What is more important is the management of the acute and long term side effects of treatment. Treatment can be toxic and can have considerable morbidity. Surgery can be mutilating. Sometimes a part of the jaw is removed, a part of the mandible is removed, a part of the tongue is removed. There is a tracheostomy. Sometimes patients have a peg tube. So all this requires a lot of rehabilitation after completion of therapy with the help of speech therapists, swallowing therapists, tracheostomy care, and pulmonologists. Similarly, radiation can cause a lot of mouth ulcers, skin changes, as well as long term consequences like strictures, which may require the involvement of gastroenterologists. And again, chemotherapy has its set of side effects. Like long-term neuropathy or low counts. So all this need to be managed during the follow-up period, and thus improve the quality of life of the patient. And I had mentioned this earlier also, but integrating pain and palliative services earlier on the course of the disease, and if required, even during follow-up, is again an important step.
Right, sir. Dr. Ashish, what do you think that support system, both institutional and family, play in improving adherence to treatment plans and overall patient care?
See, mostly we are seeing the head and neck cancer. They are after surgery. They need concurrent chemo plus radiation therapy, and we see that this therapy, the patient had so many problems. The one nutritional problem is there. Sometimes there are other side effects like anemia, thrombocytopenia, neutropenia, or sometimes a social problem, and sometimes there is a financial problem with there. So obviously, institutional help is most important. We need to keep dietitian, nutrition specialist, psychologist with the our institution, and we give one holistic approach to the treatment. Like day to day, we can assess the nutritional assessment of the patient, and plus psychological assessment, because we know that this treatment is very troublesome, because one radiation is there and another is a chemotherapy is there, and the cope up with the all this treatment is very difficult. So these patient need day-to-day assessment with the and plus rehabilitation also very important part of the these patients, also speech therapy. So we are rehabilitation speech therapist. We can look after the speech of the patient, swallowing, how to after treatment, how to they able to cope up with the life, because after treatment also there's some swelling problem is there, speech problem is there. So obviously there is a multidisciplinary approach. It's not the oncologist only involved. It's either different specialists involved in the these patients. So we institution play a major role in the head and neck cancer patients. And plus sometimes there's a financial issues there, so we also involve some social group to help to the patients. And also sometimes what happens, the patient comes far from the city, like radiation therapy. So and they come daily for the radiation therapy. So it's very difficult them to come to Delhi to the hospital. So we provide them accommodation in the hospital in the very economical rate. So there are some these are the some measures by which can we can the patient can adhere to the treatment and complete treatment. Also post treatment we give some involve some social group to for the quality of life.
Right, right. Dr. Nilesh Tamne, do you believe that newer technologies like AI and digital tools can realistically, support oncologists in tier two and tier three cities? And how soon can we expect broader implementation of these tools? Dr. Nilesh Tamne, I think there is some network issue. Okay. Okay, Dr. Chetan, how often should someone, see a doctor or a dentist if they suspect that there is some head and neck cancer problem, or if there is anything which should be taken care of?
As I said, there is no proper protocol for screening for oral cancer. So people in India do not visit dental surgeons unless they have a problem. So this system, the periodic visits to a dental surgeon happens in the United States where, and in the Kingdom, because that is also partly covered by their insurance. So their frequent visits to dental surgeons are commonplace. Here, people don't go to the dentist for the simple reason that the moment you go to a dentist, he'll either do a procedure or he'll pull out a tooth, both of which involve a lot of pain and money. So they avoid going to a dental surgeon. But again, when as I mentioned earlier, if we have a high risk patient population, patients who have been chewing tobacco or consuming gutkha for a very long time, then these patients should be proactively asked to meet dental surgeons with some specified frequency, either once in 6 months or whatever may be the frequency. And what needs to be stressed, it cannot be a one visit. It will have to be more than one visit. So periodic visits will help the dental surgeon or whoever is examining the patient to find out if there has been any change in the area of redness or a suspicious area which was there 6 months ago. This also will involve a lot of documentation. So for all these things, we need a proper system to identify oral cancers at an early stage. It cannot be done just by asking a patient to go. The patient may not go. The patient may not reach the dental surgeon.
Right. So I
So
think key
the
takeaway
first
is
step, I think we need to identify that oral cancer is itself a big problem. It needs some kind of early intervention. Early intervention at an early stage is going to bring about better results. And there has to be a structured activity program for oral cancer, which we sadly don't have. Today, our focus is on tobacco prevention, which is correct. But even early detection is an important aspect of oral cancer, and it is sadly missing. There are diagnostic centers which coming up which sell mammographies to 25 and 30-year-old women, but we don't have designated clinics for oral cancer screening, or we don't have an oral cancer screening tool in the first place. and that will have to come from us because that is our problem. We cannot depend on the West to give us a solution for oral cancer. Our oral cancer, especially oral cavity cancers, are largely related to chewed tobacco habit, which is prevalent in the Indian subcontinent.
I think this is a very good message, and I think periodic visits to dentist, is all that is required. And definitely, if we have some tool for early diagnosis, that will really help us. Dr. Chetna, we have been talking about, of course, prevention and avoiding tobacco chewing. But can you enumerate some other risk factors which can be avoided, and so that this should not happen, head and neck cancer?
Yeah. So yes, so basically, as I said, tobacco 80 to 90%, but then HPV is also one of the major risk factor in oral cancer. So we should make people aware of HPV infection, as well as we should encourage them for HPV vaccination also. That is one thing which we have not discussed about, but yes, along with the tobacco, HPV also.
So I'm taking the cue, ma'am, and going to Dr. Rakesh. That why is HPV vaccination important in preventing certain head and neck cancer, and how can we implement it on a broader scale? Dr. Rakesh.
Sorry, ma'am. Please repeat the question if possible.
Yes. So we have been talking about HPV vaccination, which is HPV is another risk factor apart from tobacco chewing. So how can we implement it on a wider scale so that HPV vaccination should be taken, and how important it is in preventing head and neck cancer?
As we know that only known etiology which is modifiable apart from tobacco or any of this thing are HPV. So it has to be vaccinated, and more and more awareness with the help of our colleagues is going to make the breakthrough for us, because to implement for the vaccination it's tough saying it's for cervical cancer, but yes, it can be used.
Right. And Dr. Lokeshwar, what should someone do if their loved ones, notice a persistent lump maybe in the neck, or there may be a change in voice? What can be done?
So, yes, the first thing they should do is go and seek appropriate medical advice. And that does not necessarily mean that they need to go and see an oncologist. But with any ENT related symptoms, I would recommend that the patient see either a dentist or an ENT surgeon or their family physician for sure. And if the problem that the patient has doesn't improve with the initial set of medications, or if the initial evaluating consultants find that there is something specific or suspicious of cancer, then they will appropriately make a referral to an oncosurgeon or a medical oncologist who can take it forward and evaluate the patient to see whether there is cancer or not.
Right. And Dr. Ashish, how can survivors, advocate to help us, raise awareness in local communities? Dr. Ashish.
Obviously, survival is the major key factor in the community because they have experienced all the treatment in head and neck cancer. They can aware about the addiction, tobacco addiction, that you should avoid tobacco, any form of tobacco. Also, educate the community regarding the treatment, how we approach the if there is any symptoms, signs, symptoms of head and neck cancer, then immediately go to the concerned physician or a ENT specialist or oncologist. And also explain regarding the treatment, the journey of treatment, like from surgery to radiation to chemotherapy, or maybe if stage 3, stage 4, maybe further chemoimmunotherapy. What are the symptoms? How they cope up with the chemotherapy? What is the chemotherapy? What is there's misconception of chemotherapy that is very toxic. It can yeah, maybe biopsy can lead to progression of the cancer. And also educated regarding the how to cope up with the symptoms of the chemotherapy or radiotherapy, like if there is a mucositis, yeah, sometimes loose motions or sometimes fever, So, and how we improve nutrition during the chemotherapy or radiotherapy. So there's so many way the survival can make awareness in the community and maybe give positive feedback regarding the treatment, because there's so many fear regarding the treatment of head and neck cancer, that surgery, because of surgery there is some facial disformity, formality, where they maybe we are not going to cure. So obviously there is a major role of survival in the community.
Right. And Dr. Nilesh, what are the most common misconceptions or myths do you believe are prevailing in head and neck cancer patients? Dr. Nilesh Tamre. I think we have, there is some network issue. Dr. Chetan, can you answer this?
Sorry, can you just come back with the question again?
Yes. So, what are the most common misconceptions and myths that are there amongst people about head and neck cancer?
Several misconceptions. Most of them stem out of lack of education or the fear of spending more on treatment. The commonest being, if you do a biopsy, the disease spreads faster or it goes down to the neck nodes, which is one of the commonest misconceptions about any lesion in cancer. The second is, if it is in the oral cavity, it will heal on its own. So it need not be tackled at its time. You can take it lightly. That is the second thing. Third thing is, most people believe that after surgery and everything is done, you don't need radiation or you don't need any additional therapy, which is not the case. In fact, most of our patients, almost 70-80% of our operated patients, do need some kind of adjuvant therapy, and that has to be given appropriately. Otherwise, the chances of relapse are very high. And the fourth thing is, people, after a certain amount of time has gone by after their treatment, they believe that they are cured and then their disease is never going to come back, and they go back to their bad ways of chewing tobacco or consuming alcohol, which can bring out a relapse very fast.
Right. I think Dr. Nilesh Damdia, you are available now. Yeah. Can you hear me, Dr. Nilesh? Yes. Can you hear me? Dr. Nilesh?
Yes.
Okay. So, sir, I was asking that do you believe that newer technologies like AI and digital tools can realistically support oncologists in tier 2 and tier 3 cities? And how soon we can expect a broader implementation of these technologies?
So whatever previous discussion we had, we concluded there is a lack of infrastructure, lack of availability of specialists. So what the digital technology can do, they can form a bridge between the diagnostic infrastructure and the specialist opinion. So AI tool can help that getting that bridging the gap. For a tier 2, tier 3 city, as there is a resource constraint, AI based technology like capturing the image through mobile camera, getting stored in the iCloud, and getting access, acknowledge, and their diagnostic by AI-based tool can help identifying early oral cavity or any head and neck cancer. That will make aware the patient they should reach a specialist for the definitive curative treatment. Is it a reality or just a hope? So I think it's a reality. At Kolhapur Cancer Center, we are developing an app which is under the care of Oral AI CLE. So 5,000 images of healthy oral cavity versus a cancerous tumor images we have uploaded. And now we are training ASHA worker to use a mobile and capture that image. So they will get stored in iCloud, and AI app will process. They will match their disease based ones, and they can inform, they will give an alert. As we were discussing, and Dr. Chetan rightly pointed, the sensitivity of any screening test has to be higher to the tune of more than 90%. Unfortunately, in our pilot, we could find up to 83 to 85% the sensitivity. So we are on the verge to we need to improve the sensitivity. We may get a few false positive that may be acceptable, but the sensitivity on a higher side. I find this a realistic aim in the coming 3 to 5 years. We should have this diagnostic, advanced AI based, or any technology based tool that will bridge the gap of this lack of access to healthcare or this specialist or maybe a diagnostic infrastructure. I feel digital awareness is a key in today's era. The health workers themselves has to be digitally empowered, and then eventually they will pass on to the next level, maybe the groundless worker. So I think AI based worker is the key, is the future. Yeah, they may not replace the actual things, but yes, they can bridge the gap. They can find a way to reduce this burden.
Definitely, sir. Taking pictures and storing them and comparing them with the previous pictures, and definitely training our ASHA workers can help us detect it. And definitely, digital tools. These are easily available and widely acceptable as well. They can be implemented. And good luck to you, whatever you are doing and trying to do.
Thank you.
And Dr. Nilesh Lokeshwar, I would like to ask you that there are certain, newer therapies coming, like immunotherapy. How much applicable they are uh, in case of head and neck cancers?
So, so they are. I mean, so there's a lot of new things that is happening in the field of head and neck cancers. I think one of the just the identification of one group of head and neck cancers that are HPV driven has helped us decrease the intensity of treatment in these patients because we know they do well. And similarly, there are other patients who've got more aggressive, more high risk disease or disease that is metastatic. And today we have immunotherapy, which is replaced or been an addition to the standard chemotherapy in the treatment of patients who've got stage 3 and stage 4 disease. Not only in those patients, but even in earlier lines of therapy. So after surgery or during radiation, immunotherapy has shown to improve the DFS and the survival. So while immunotherapy is important and does benefit a significant group of patients, I think in head and neck cancer, the focus should be on local therapy and early detection. And I think that's why the discussion of all the other speakers before me are very, very important.
Right. So, I think one question I would like to ask each and every one of you, since you are practicing clinicians and you are, seeing patients on daily basis, that what are the early warning signs of head and neck cancer that people should never ignore? So, I'll start with Dr. Chetna first.
So head neck cancer early signs. So one is ulcer in the oral cavity because it is very very common. Many times people feel that it is just vitamin deficiency and they start taking vitamin tablet. So ulcer in the oral cavity. Then in patients who are consuming tobacco, if they see some white plaque inside the buccal mucosa, that is one sign. If they are not able to open their mouth, that is one sign. These are early signs. If there is any change in voice, that is one of the early signs of head neck cancer. If there is difficulty in swallowing, then if they find some lump in the neck, that is actually not an early sign, but if they find some lump in the neck, they should go to a doctor immediately. So these are very easy, and anybody can, when you look at the mirror yourself, you can see all these signs. And then if you feel that there is something, then you should definitely go to a doctor.
Right. Dr. Chetan.
Yeah.
So, what
Hello.
early? Yes. What are the early signs that nobody should ignore, and so that we can give a good message to our public about the awareness. What are the early signs?
I think Dr. Chetna has just listed most of them. I don't think I can add anything except for maybe a reddish patch or a whitish patch anywhere in the oral cavity or a symptomatic loosening of teeth. Uh, that can be something which is often ignored, because it if there is no pain, then the loosening of tooth is often attributed to something else. Having said that, people with bad oral hygiene, poor oral hygiene, people who have stained teeth, people who have deformed teeth, people who uh, uh, have been chewing tobacco for a long time, need to pay more attention to their oral hygiene. Even adequate oral hygiene itself will help people prevent some of the cancers or detect some of them at an earlier time.
Right. And Dr. Rakesh, would you like to give some message? We have discussed early signs. Would you like to give any message to our viewers that how can they take care of themselves so that this should not happen, because this is something which is preventable?
Apart from oral cavity, the laryngopharynx part has also to be taken care of. If you are having any of the difficulties with degglutination or a pin feeling in the throat, you should consult a good ENT person or ask for a laryngoscopy examination, because most of the time it's not obvious. It's suppressed maybe somewhere in the piriform fossa or on the vocal cord. So wherever there is any abnormality in the entire head and neck region and which is not making you comfortable, just visit your ENT person or a dental person and get a thorough examination. It may be infection, but it may be a cancer.
Right. Dr. Ashish, any closing remark, any message that you would like to give to our
My
viewers?
the key message is the avoid the tobacco is the most important. Any form of tobacco, like in our city, the like mawa, they call mawa, the mawa, keni, matri, any form, avoid any form of tobacco. Smoking, bidi smoking or filter, yeah, sometimes electric smoking, they all are injurious. Avoid alcohol, keep good oral hygiene, and also aware about the HPV vaccination in the boys. Girls, we know the cervical cancer, there are good awareness now in the girls, for the boys also HPV vaccination now with the trend. So we can plus continuous medical education, awareness through YouTube, awareness through uh, other social media platform, and that don't ignore the any symptoms or signs of the any form like white patches or red patches, bad oral aging, halitosis, or sometimes nasal blockage in the nasopharyngeal carcinoma and difficult in swallowing. So obviously avoid tobacco, alcohol, plus don't ignore the early sign and symptoms, and frequent visit to the dentist or ENT specialist if there is anything in the head and neck region.
Right. Dr. Nilesh Damne, you want to add anything?
No, I would just like to just summarize. So head and neck is definitely a significant problem. Painless ulcer, any neck swelling or changes voice may be the commonest symptom. White patches, leukoplakia may be a precancerous lesion, so they should be followed. Don't keep any taboo. If you feel any of these symptoms, you try to reach your specialist. And HPV vaccination is the key. Apart from prevention of tobacco, vaccinated may significantly decrease the burden of head and neck cancer in India. This is the take home message.
Right. Dr. Lokeshwar,
Um, so, um, so, in my opinion, ignorance, denial, inaccess or poor access to healthcare, and fear of treatment are three or four very important factors that are limiting early treatment in head and neck cancers. 25% of our patients come with disease that you can diagnose by looking at them from 10 meters away. Large ulcerated lesions in the mouth, whole with discharge of pus, big tongue tumors. And so it's not that the patients didn't have symptoms. It was just that they were either in denial, or they had alternative therapies, or they were scared about a biopsy because of that concept that if you do a biopsy, the disease is going to spread, or they were seen by somebody and advised a surgery that they consider very mutilating. So I think a significant proportion of our patients come with such large tumors that it's not about just early detection, but educating people about the fact that if you pick this disease earlier, you'll have a less mutilating surgery, you'll probably have less treatment, and your outcomes will be better.
I think this is a very good message that if disease spreads, definitely it would be more mutilating for the patient and morbidity would increase, pain would increase, and so many other things have to be taken care of apart from treatment and emotional support, everything. And I believe that early detection needs awareness, and this is what we are doing. And I thank you all for joining us today in this important conversation about head and neck cancer. Let's continue to raise awareness, break the stigma, and support those who are affected. Thank you so much.
Thank you so much.
Thank you. Thank you very much.